Dr. Sunil Joshi, welcome to First Coast News Plus, our First Coast News Plus studio. We're excited to have you here with us today.
Thank you for having me. It's a beautiful studio. I'm so glad to be a part of this.
You know what? You are Jacksonville's first chief health officer. That comes with a lot of responsibility. You're part of history within the city of Jacksonville. A lot of folks are likely wondering exactly what is a chief health officer? What does your role entail?
Yeah, so obviously I'm honored to have this role, and Mayor Deegan, providing me this opportunity. But as a chief health officer, basically what we are here to do is to be the spokesperson for all matters related to health for the city of Jacksonville, and to coordinate planning and preparation during public health emergencies, but at the same time trying to improve health outcomes for our community. So that may be just us collaborating, communicating, coordinating efforts that other groups in town are doing. And we have people in Jacksonville who are doing great things to impact health. They're just doing them in a lot of cases in silos. And so we're bringing these groups together to coordinate these efforts so that we're all moving in the same direction with the same goals to improve the health outcomes for our city and to reduce some of those disparities that we have in Jacksonville.
I'm so glad you said that, because we have a lot of groups within this city working towards a healthier Jax, as you mentioned, but a lot of people don't know about them, these many groups. How are you streamlining that process, streamlining it for folks who know this is where you need to go if you need this type of help?
Right, and so this is why the health officer becomes important, right? Because by meeting with these different groups, we're learning what each individual not-for-profit, hospital system, or just individuals are doing to improve health outcomes or awareness. And by bringing those groups together, so we'll bring people together in the mental health space or in the pediatric care space or the maternal health space, and then we move together with the same mission and goals. And then we develop resources on our website, the City of Jacksonville website, free resources for people to go to know where they can get help, where they can find the people that can do what they need to get the help they need to improve their outcomes themselves. And so a lot of this is coordinating those efforts so that we can communicate with the public about what is available. Educating people about what's out there is half the battle. Once people know that there are resources there, they're more likely to go after those.
You said the key word there, free. A lot of folks need the free services.
That's right.
Tell us about HealthLinks Jax.
So HealthLink Jax is one of our exciting new programs. So as we talk about the fact that we have health inequities and disparities here in Jacksonville, a lot of that is based on socioeconomics. And so some of the folks who may not have jobs or who do not have the ability to get the job that provides health insurance for them are the ones that are the least likely to go have a primary care doctor. If you don't have a primary care doctor, you don't get the preventative health you need, and you end up using the emergency room as your source of primary care. And here, you don't have health insurance. The emergency rooms cannot deny you care, so they provide you with care, and then they charge the patient the visit, which could be in the thousands of dollars. Most of these folks who don't have health insurance then can't afford that care, and so then the hospital eats that cost. And so HealthLink Jax is basically a way for us to say, hey, to the uninsured population, if you feel like you need to go to the emergency room for an acute illness, call this number first. You call that number, you get connected with a nurse who will triage you appropriately, get you set up with a physician right there on your phone with a link. You'll be connected with a physician within seconds, who can then determine whether you really do need to go to the emergency room, or can I treat you right now here on the phone, send a prescription to your pharmacy, or refill your meds, which in a lot of cases is what people need, and get you then connected to a primary care network here in Jacksonville. So through Jax Care Connect, we have what we call the Duval Safety Net clinics, which provide health care to the uninsured population. And so this program links them back to Jax Care Connect so they can then be linked to a primary care doctor. And people who go through the Jax Care Connect system have filled out surveys, and believe it or not, about 78% of the people who fill out those surveys say that they had gone to the emergency room in the previous year between 1 and 3 times, and 50% of them said it was for a minor illness. It's something that could have been taken care of by a primary care doctor. And so not only is this bad for that individual because they're not getting the preventative care that they need, it's also bad for the hospital system, which loses money, and then the taxpayers pay for that to keep the hospital system whole. So by putting this process in place, we're hopefully not only helping the individual get primary care, which is what we really need to keep people out of the hospital, but we're also saving taxpayers millions of dollars in the process.
Dr. Joshi, I want to get in the weeds a little bit here, because you say these things, but for a lot of folks, they just don't quite understand. Here's why. A lot of people live in bubbles, right?
Right.
They have never experienced the situation where they can't afford health care, they can't afford to get the services that they need, but there are a lot of people in our community right here in Jacksonville who simply can't afford to get the healthcare services that they need.
Right.
So speak to the disparities that you're seeing here within our city.
Yeah, and so here in Jacksonville this year in particular, we have 86,000 adults between 65 and 18 who don't have health insurance, okay? And so in that case, it becomes very hard to see a doctor, because you go in to see the doctor, you have to pay out of pocket to see that individual. That in itself makes it very difficult. But, for us to address that, we have to get down to the root causes of why we have these disparities. And we do believe that a lot of this is due to the social determinants of health. It's things outside of the clinical practice that are affecting people's health. Data suggests that only 20% of health outcomes come between the doctor and the patient talking in the exam room. The other 80% are things outside of the control of the physician, and that includes your education, your job status, your income status, socioeconomic status, your healthcare literacy, housing, food security. All of these things impact health, and so until we can address those social determinants of health, these health inequities are going to continue to persist. And so it's part of what this administration is doing, which I think is going to have the biggest impact, is the workforce creation, workforce development, socioeconomic housing security, homelessness prevention. All of these things actually do help to improve health outcomes. So we look at things in silos as well, that, this is just keeping people in their home. Well, actually, keeping someone in their home is most important at keeping them healthy as well. And so all of those things add up to make our community healthier. And so we do have to address those social determinants of health in order for us to improve health outcomes for everybody.
They all tie in. Sometimes folks don't realize that. They're all connected one way or another. Jacksonville's pretty unique. You have a unique challenge ahead of you.
Yeah.
We have certain parts of this city thriving,
Absolutely.
right? You think about the beaches, Ponte Vedra. Folks are living very well,
Yes.
very comfortably, and doing just fine. You come a little bit closer to where we are now in downtown Jacksonville, East Side, completely different story.
Right. That's right. And so what makes Jacksonville unique, and what's part of what makes Jacksonville beautiful, is our uniqueness, our diversity, the fact that we're diverse by ethnicity, by religion, by geography, by socioeconomic status, by the river, the beaches. All of these things help to make Jacksonville what Jacksonville is. However, this is also where we see our disparities. And you nailed it. I mean, there are parts of our community that are so healthy. They would rank in the top 30. If some parts of our community were countries, they would rank in the top 30 in the world for being the healthiest in the world. And there are other parts of our city that, if they were countries, including where this studio is right now, would rank 160th. And so, like, for instance, Health Zone 1, which involves zip codes 32204, 06, 08, 09, and 54, which is in this urban core, have health outcomes that put our life expectancy in this zip code at 68.1 years of age. If you just go about 5 miles down the road over the Main Street Bridge, through San Marco, Hendricks Avenue, San Jose Boulevard, down into that 32256, 32223 zip codes, they have a life expectancy up to 81.1, which would make them the 32nd healthiest country in the world if they were a country, right there with Denmark and Austria. Whereas the zip codes that we are in right now, Health Zone 1, would rank as the 162nd, and that would put them right between Rwanda and those countries in South Africa, in the African region. And so all of that kind of can let you know that we have a significant issue here in Jacksonville, divided by the river. Just within 5 miles, we have disparities in health. It goes back to redlining and some of the longstanding generational discrimination that's occurred throughout the country, but in particular in the South, and Jacksonville's a perfect microcosm of that here in Duval County.
We need to talk about moving forward from that, right?
Yes.
I mean, how do we do that?
Right, and so this is where we come back to addressing those social determinants of health. And so, as an administration, what Mayor Deegan is doing by helping with job creation, workforce development, healthcare literacy through the River City Readers program, what happened with the Jaguars deal for the stadium. So you think about, this is about the football team. No, so the community benefits agreement, which is to help create jobs and to help with workforce development, help with literacy, and help with homelessness prevention, is all for communities out east here in this region, but also throughout Jacksonville, to try to help eliminate some of those social determinants of health that affect health outcomes. And so as we move forward, as you start using this $150 to $300 million that are going to be used to impact these social aspects that affect the economy, they will also improve health outcomes, in particular in these neighborhoods that have been overlooked for generations at a time. And so that's why we feel like this is such an important part of the entire community benefits agreement.
You and I have had conversations is about this, and something that I tend to forget. The infant mortality rate, when you compare in different zones, these different areas you're talking about, mind blowing.
Yeah. So if you look at infant mortality in Jacksonville, infant mortality is basically the number of children who die per every 1,000 live births in the first year of their life. And in Duval County, we have about 7.2 infants who die in the first year of life per every 1,000 live births, which is above the state average of about 6, okay? But that disparity is significantly different if you look at it by race. So if you look at our white population, about 4.3 per 1,000. Our black population is 11.2 per 1,000. So you're looking at 2.5 to 3 times more likely for a black baby to die in the first year of life compared to a white baby. And this goes back to some of those social determinants of health that we talk about, and the disparities and not being able to access health care during pregnancy and even before pregnancy, taking care of your health before pregnancy, during pregnancy, after pregnancy, and then also understanding the educational aspects of how babies should sleep in their beds and overcrowding. So for instance, if you have 6 people living in a 1-bedroom apartment, where's the baby going to sleep? Right, so it does come back to the housing situation as well, having affordable housing, mixed income housing, preventing people from being homeless, having space for everyone to live and sleep and eat and live their lives impacts certain communities more than others. And so if you're not addressing homelessness, if you're not addressing the housing crisis, you're still really not addressing infant mortality either. So it's all connected, and it does have to work in unison.
I don't like just talking about problems because there's solutions out there available. Tell us about what you're working with right now. What's the name of the group that you're working with?
Northeast Florida Healthy Start Coalition, who has done great work in this infant mortality space. In fact, they utilize something called community health workers, which you may have heard of. These are people who have shared life experiences. In this case, they may be moms who have suffered with infant mortality themselves, moms who may have been in similar situations as some of these young mothers that are out there. And they, with a grassroots effort, are able to, looking at survey data, identify folks who need to be referred to programs for educational purposes, whether that's pre-pregnancy, during pregnancy, or after pregnancy, to not only help the mom's health and the family's health, but also so to help the infant's health, make sure that we're getting our vaccinations, make sure we're seeing our pediatrician, make sure we're doing what we need to nutritionally to keep these children healthy, and of course the sleeping patterns as well. And so utilizing these programs, actually, they have been able to positively impact infant mortality here in Northeast Florida. Infant mortality rate has dropped by 25% since 2018 because of programs like this. Now, we have ups and downs in that trend, and we'll have the 2023 numbers come out soon, and we might see an uptick in that. But so what the city of Jacksonville is doing is supporting the use of additional community health workers so that there's more people out there. One community health worker can touch as many as 150 to 250 lives. And so the more folks that they can touch and interact with and educate and get into the services that we need to get them into, the more babies we're going to save. If we just save one baby, that's a huge outcome, positive outcome. But if we can impact those infant mortality numbers and continue to drop them at a rate of 25% every few years, we're going to see those numbers improve significantly, and then hopefully get to the point where these children not just live and survive, but thrive as they go forward through the rest of their lives.
Dr. Joshi, you're obviously very knowledgeable about this, but there's also a certain amount of passion that you're speaking with.
Yeah.
Those who are listening, you can hear it, can see it, can feel it. I can. I'm in the room with you right now. That's because Jacksonville is special to you.
Yes.
Born and raised in the Arlington area,
Right.
Graduate of Terry Parker High School.
Right.
Tell us about that.
Yeah, I was born and raised in Jacksonville. My parents came to Jacksonville in 1968, and at the time, there were just one of 3 Indian, and I'm an Indian American, one of 3 Indian families in Jacksonville. We now have thousands of Indian families here who help with the economy here in Northeast Florida. But grew up in Arlington, born and raised here, went to University of Florida, wanted to come back here to practice medicine because this community was great to my parents as immigrants into Northeast Florida. My dad ran a business, and my mom worked for the federal government, was an IRS agent. They put 2 kids through public schools here, Terry Parker High School, and then both kids went on to college. My brother's an attorney, and I'm a physician. And I really feel strongly that a lot of this had to do with the nurturing nature of the people of Jacksonville, with all the great things that we have here in Jacksonville, the beaches, the river, the weather, and all of those great resources we have. It's the one thing that drove me back here were the people. The people of Jacksonville are uniquely caring folks. And so if we can figure out a way to make us all care about each other, the way we get together for hurricanes and for tragedies and for the Jaguars and successes and things like that, if we could do that in every aspects of our lives, and in particular in this case for the health of our community and the social determinants of health, we could be the healthiest, most dynamic city in the country. And that's what we want to be. I mean, we are so close to doing that. We just need to get over some of these challenges.
The possibilities are definitely there when you think about what we have available to us, right?
Right,
absolutely. The green space, the beaches, plenty of access. But why do you think it is that folks are not taking advantage of what we have here to offer?
Yeah, and that's a great question, right? We have beaches. We have the most beautiful beaches in Florida. I mean, I know that's an opinion, but I mean, if you walk on our beaches with our white sandy shores compared to the other ones up and down the east coast of Florida, where we don't
get specific now.
Right? Yeah,
don't sell anybody.
Yeah, that's right. We don't have the cars on our beaches, right? We're walking on these beautiful beaches, and this time of the year, especially as the weather gets cooler, it's special. Our river, the river walks, the North Bank and South Bank River Walk, and as the North Bank River Walk gets completed all the way down here towards the stadium, it's just a beautiful, easy way to access a natural beauty. Our park system here in Northeast Florida are also fantastic. But people don't access them. Some of that is the knowledge of not knowing that they can. Some people don't feel like they're safe to access these areas. And again, this all comes back to what we talked about earlier, the infrastructure, developing appropriate lighting, making so that our sidewalks are bigger, making so that we're bike friendly. The Emerald Trail is going to play a huge role in this, right? We're going to connect communities with the Emerald Trail, make it so that physical activities become part of our daily routine. But at the same time, we're going to do it in a way that we can enjoy our natural beauty and connect the north side with the riverside and the riverside with Arlington all the way through our river system and our natural beauty here in Jacksonville. And so getting that word out, educating people about the benefits of physical activity is part of our job. We have, data suggests that you really should have about 150 minutes a week of cardiovascular activity to prevent your risk of heart disease and stroke. But it's not just heart disease and stroke, it's also your mental health. So I'll have patients tell me all the time, well, my job's a physical job. I'm always packing and unpacking, so I'm getting my physical labor in. But it's not just about that. It's about your mental well-being. So when you have intentional exercise for 150 minutes a week, that's your time to think, to decompress. As you're helping your physical health, you're helping your mental health, and that's how we make ourselves healthy overall.
I want to ask you about this because you mentioned the Emerald Trail. Jacksonville is growing, right? That's
Yes.
a constant thing here. We have a lot of room to grow.
Yes.
But you said before you want to see Jacksonville grow in an intentional way. That's
Yep.
the word you use in particular.
Yep.
Intentional in order to be healthier. What does that look like to you exactly?
Yeah, so Jacksonville keeps growing. People keep moving here. Businesses keep moving here. That's all great for us and great for our economy. But as we're growing, we need to be growing with the health of our community in mind. So if you're developing an apartment complex, a mixed income apartment complex where you're having all comers want to use it, as that development and that developer is developing that apartment complex, we need to improve the infrastructure in that region. Let's get rid of the septic tanks at the same time. Let's widen those sidewalks. Let's have some protected bike lanes. Let's make sure that the apartment complex has a workout facility, a gym, a pool, in ways that can keep people healthy. Same thing as we're incentivizing businesses to come to Jacksonville and increase our economy. We should be incentivizing them in the process to provide health insurance for all of their employees, not just the executives in the C-suite, but the folks that are doing the work at the ground level as well, because in fact, these are the folks who need the health insurance the most. So if you're going to come to Jacksonville, bring millions of jobs, utilize our amazing environment and our tax base appropriately, let's also help the people that you're employing. Let's get them health insurance and get them access to primary care as well. So this is all part of, as you grow, to have an intention towards health as you grow will also help to improve the outcomes for health in our community. So we should be growing in a way that's not just helping us economically, but helping the health outcomes in our city as well.
Yeah. Dr. Joshi, the stage is yours. Anything you feel the need to add or mention, or you feel the people of Jacksonville need to know?
I think what's important is for people here to know that this city, the city government, the administration, even the city council here in town feel like health is a priority for Jacksonville. And I think that it's about time, right? Because we're growing in so many ways, but our health outcomes keep us down. We're 46 out of 67 counties in the state of Florida for health outcomes. Yet we have such a beautiful city to live in and so many opportunities. And it comes back down to those inequities in healthcare and inequities in outcomes. And if we could work together to allow growth to be intentional and to grow into the neighborhoods and the communities that really need that growth, the south side of Jacksonville should be just as healthy as the north side of Jacksonville. We should be able to bring those health outcomes to the entire community. And if we can increase that access so that we can utilize the Mayo Clinic, UF Health, Baptist Health, Ascension Health, all of these great health systems that make us a very healthy community, so that those areas of town where folks who have otherwise been underserved when it comes to health outcomes can have that same access, Jacksonville will not only move up those ranks, we will be the healthiest community in the state. St. Johns County is #1 in the state year in and year out. They're just a few miles south of us. Why can't that happen in Duval County? And we should be able to make that happen as long as we're all working together.
Dr. Joshi, your position of Chief Health Officer is not common in other cities. Why is that?
Well, because I think in most communities, when people are looking at population health, they look at the Department of Health as the conduit for that population health, which is really the way to do it, right? So the state typically controls the Department of Health, but Duval County is so unique. We are one of the more unique cities in America. We have 840 square miles to cover. And a State Department of Health that continues to have less and less funding means that you have less and less employees and less ability to focus on the community's health. Then you need another entity, the city government, which is just focused on the city's health to help provide some of those services, or to get those resources out there and communicate, coordinate, and collaborate so that we can all move forward. And so by having a chief health officer who's focused just on Duval County, just on Jacksonville's health outcomes, I think does make an impact. And so for us here in Jacksonville, we work very closely with our Department of Health to improve outcomes. And so we have that unique ability here to make it work. Other cities may not have that ability. And so it's hard for me to find chief health officers to interact with. There's a lot of chief heat officers, resiliency officers out there, but chief health officer is not very common. Yeah. And so for this, we're kind of building our story as we go so that other communities can copy what we're doing and be as successful as we hope to be.
The pressure's on.
Yeah, we're going to do great things. I feel like as long as we're all moving in the same direction. And in the 18 months that I've been here, that's the one thing I've learned, is that people do want to see our outcomes improve. Yes, we have groups working in silos, but being the quarterback organization, which I think a city government can do, right? The highest level of city government saying, hey, we want you guys to work together so that we can have these outcomes. And in the process, we are going to implement programming that you guys think are important to make this happen. And so that we're all working in the same direction, because they'll complain about what's not working. Okay, let's talk about how can we make it work? What can we do to help you make that work? And if we're able to continue to do that, like we have in the first 18 months, there's no reason why we're not going to push this ball across the goal line and start to improve those health outcomes for all of our citizens, regardless of race, ethnicity, or socioeconomic status.
HealthLink Jax. That's what they need to go to, right? Check that
HealthLink Jax, which is our great program for getting virtual care to keep people out of the emergency room, is a phone number, 904-925-CARE. We also right now are in the middle of Get Covered Jax, which is all we're doing in this program is educating people about the Affordable Care Act and connecting them with navigators, volunteers, and licensed insurance brokers, so they can help people navigate the health insurance world and understand that there are subsidies that they may qualify for, so they can actually sign up for that health insurance. to keep them healthy as we go forward. So these are things that aren't even costing us taxpayer dollars, that we're just utilizing our ability to get that information out there. Our mayor says all the time, a confused mind says no. The more that we can educate people about the ease of the process, the more likely they are to take advantage of these resources that are out there.
All right, the resources are out there. That's the key thing to let folks know.
100% they're out there, and we just want to collaborate, communicate, and coordinate so people understand that they have these advantages here in Jacksonville.
Dr. Joshi, thank you so much for your time. We do appreciate it.
Thank you for having me. I'll be happy to talk about this any day of the week. I could talk about this for hours.
Yeah, clearly. We both can, all right?
Absolutely.
Thanks.